So a couple of evaluations that I did this year at DCG specifically were I had two athletes that were on the football team, and they came in complaining the day after of knee pains. So right away, I grow concerned because these are younger athletes, and you obviously don't want them to have any kind of injuries that can be severe enough to, cause them pain or issues ahead of time, or in the future. So as Jared was, hanging out and watching me from behind. Sorry, I'm trying to plug in my charger here before my computer dies. Okay, so they came in, and the first kid came up to me and started explaining to me what happened. So his mechanism of injury, and he was, playing football. He was on the football field, and he got clipped from behind. His knee hit the ground. So initially I go towards thinking, okay, this could be meniscus. It's common. With future learning, because at this point we hadn't gone over the knee yet, I could have suspected that it was the, what is that? Where, I can't remember, but it's the mechanism where your knee just slams straight into the ground and usually causes severe injury. But he was having issue with his knee. He got clipped from behind, fell directly onto his knee. It was causing him pain when he did anything brisker than a walk, and that wasn't good. So I took his history, asked him if he had ever had any issues before. He said no. Any issues before with his knee? He said no. Was he taking any medication or self-treatment? He said, no. He was just icing. I asked him specifically what it felt like. He said that there was some catching and some pain. And so right away, just from previous conversations that me and Jared have had, the catching and the popping is a big sign for meniscus tear. And so I was like, okay. I got him sat down. Jared kind of followed me as I was taking their history and whatever. And after I took their history, I was able to palpate and inspect kind of what was going on. There was no change in his gait, as I described in my SOAP note. There wasn't severe swelling. There was mild swelling, but there was not severe swelling. Just a little irritation. There was some inflammation, but not to a point of worrisome. But you never know. So I was palpating. I was making sure that, it wasn't his hamstring, his MCL, his patella was in the right space. So, you can do that by just looking. I palpated all these things. I did a couple manual muscle testing, just testing to make sure that his quad was contracting like it was supposed to and pulling that kneecap back. That all seemed great. Upon some of my observation, there was an area on his knee where he had some scratches. Just like a normal, you fall across the floor, you get that nice surface cut. And I asked him if this had anything to do with his pain, and he assured me that it had nothing to do with his pain and that there was much more going on. But so I still kept palpating, I still kept inspecting. There didn't seem to be any issues with his other structures. So from there, I'm thinking, he seems fine. There's no popping or catching or, crepitus when I'm moving his meniscus around, or I'm moving his knee, causing that meniscus to deal with some friction. So after that, obviously, Jared came in and he palpated as well, and he inspected as well. And then we kind of came to the conclusion that it was just a bruise, and that this kid would be fine. It was a very tender bruise because he was very tender to the touch on his palpation, specifically on top of that abrasion. So we had him ice, and he was sitting out of practice that day, but he was clear to go back to practice starting next week. And then we had the other kid that came with him. Had knee pain. Kind of the same details prescribed, except he had pain when he was walking. Like, there was pain when he was walking. And that was something that grew to my attention, but I didn't want to jump to any conclusions until I figured out exactly what was going on. So after he told me his mechanism of injury and just how he had gotten hit, and he basically got clipped from the backside, doing the same thing after I palpated and did my inspections, and then I let Jared came in and did his inspections. I came to the conclusion that it was the same thing, but I didn't want to say it because I wanted to see if Jared was on the same page as me or if my thought process was correct. Jared said that it was a bruise as well. So they both had bruises. The second kid was not as severe as the first kid. The first kid seemed to be more tender, whereas the second kid, he definitely was uncomfortable but did not seem as tender. So we let him go to practice that day because he wanted to, which is fine. So if you're, I feel like if an athlete is capable of doing it, that they have no reason not to go to practice. But there was that. After that, I got to fill out my SOAP notes. Just kind of describing what I saw. There was no chain of gait. There was minimal swelling. Writing down what the athlete described had happened. All that fun jazz. It was very exciting. So there was that. Then I got to do it so that Jared got to read it and reflect on it. And after he was going through my readings, there was a couple things that I mixed up. I put my special test and my manual Welsh test in the wrong category. I should have been more descriptive in my plan of action category. I said scratches instead of abrasions, which you'd think I would know that by now, but you never know. So yeah, there's just a couple things I pinpointed. So I think definitely one of my weaknesses would be my medical terminology and the fact of a professional setting, because these are things that are going to get passed on, to other professions in this field, and they have to understand what I'm talking about or what I'm saying, and I can't use my, urban language all the time as a mutual communicator, if that makes sense. I think that was definitely one of my biggest weaknesses. I think one of my bigger strengths was just my patient interaction. I didn't talk down to athletes. I didn't try and overload them with medical terminology and do so much that they were just completely lost and had no idea what I was talking about. I kind of, in a sense, made it easier to understand what was happening and what was going on, what I was testing and why I was testing it and all this other stuff. But I think 2 goals of mine that I can work towards would be definitely developing a more medically professional, a more professionally acceptable communication way to speak about medical terms. That, and definitely being quick on my feet. Not having to, I guess not having to ask so many questions, but being able to ask questions and minimize things and take things out right then, instead of adding a whole list of questions and playing, takeaway 1 with all these. So I think that was something that I can set a goal for and work towards, and have somebody reflect on me and tell me, how I'm doing and what I can do better. Because after Jared did that, I felt like I felt awesome. I feel like I could take a patient eval. Will it be the perfect, most professional one? Probably not. I still have a lot of practice to do, but I think just talking about it, being able to go over it and see what I was doing right and see what I was doing wrong was very important to me. And it helped me out a lot. So that was awesome. So yeah, my weakness would definitely be writing things down professionally and speaking in a more professional manner. And also just thinking better on my feet. But I think my strengths are definitely my patient care, and anything outside of my two weaknesses. So I think I did a pretty good job overall being able to document it. And obviously, though, I do have some work to do on my scratches to abrasions. But being able to document it and keep track of it, I think was very important and is very important in our field. So that is my evaluation reflection, and I hope you enjoyed it.